The week is 212 Choices, 212 Choices, which is 212-246-4237. 212-246-4237. Here's the word from the voice.
Cancer treatment most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal too. He's first in America, first in New York, first for you with body radiosurgery. We hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212 Choices, 212 Choices for a fresh second opinion. Most insurances, Medicare, Medicaid, accepted. Not only super convenient, super. Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212 Choices.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why Dr. Lederman's custom tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid accepted. Call Dr. Lederman at 212 Choices, 212 Choices for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212 Choices. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212 Choices.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212 Choices for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hey, we are back, and this is Dr. Lederman for the Radiosurgery Hour, talking about cancer treatment and how to have a better life and how to avoid pitfalls. And one big pitfalls are conflict of interest between some doctors, some hospitals, and their care. So here's an article, just in the New York Times again. You may think, wow, where do I find these? Well, it's not hard when you have an article in the business section of the New York Times written by Katie Thomas and Rachel Abrams, and it's entitled Financial Ties Between Doctors and Healthcare Firms Are Detailed. Well, when there's a relationship between the doctor and outside groups, it may mean that your concerns are not primary. Doesn't that make sense? Now, a cancer treatment center like ours is private. We don't take any money. We don't take money from drug companies, from surgeons. We don't do these things. Our relationship is with each patient. It's with you. It's taking care of you. So there's no drug companies paying us millions of dollars. And actually, one cancer center in Boston, which I know well, small cancer center, is getting $60 million from drug companies. Makes you wonder how much the guys in New York are getting. In this article written by these two women, they write, for some doctors, treating patients isn't the only way to make money. Doctor in Michigan was paid more than $300,000. The retired chief executive of Mayo Clinic, who helped write its conflict of interest policy, received more than $237,000 serving on multiple corporate boards. Well, these doctors are serving corporate boards. What's the responsibility of corporations? Yeah, it's to sell their products and make money. It's not necessarily taking care of you. And you are why we are on the radio, to give you this information, to, if you wish, take care of you without conflict of interest. There was a Florida doctor who got more than $100,000 from a device maker, and he didn't disclose that when he mentioned one of the company's products in a research article. So here he is talking about their product in a research article as if there was no ties. So it actually is a secret tie that he's getting paid $100,000 from this company while he's writing a scientific article about their products. Is that conflict of interest? I think so. In the 5 months that ended last year, and this is from the New York Times, doctors and other healthcare professionals made more than $212 million for drug and device makers. This is according to data released on Tuesday by the federal government. It sheds light, they write, on the murky financial ties between physicians and health care industry. Well, wouldn't you like to know if your doctor is getting money from the health care industry? Again, we are not. We get zero from pharmaceuticals, device makers, surgeons. We get zero because we're taking care of you without a conflict of interest. They write in this article, the list of doctors who earn more than $100,000 in speaking and consulting fees include practitioners of diverse backgrounds and interests who were paid by drug and device makers for a variety of reasons. Even Dr. David Kessler, who was the commissioner of the FDA. The commissioner of the FDA in the 1990s, David Kessler, was paid more than $200,000 for serving on a pharmaceutical board. Wow. Wow. And here's other doctors who are continuing to work. One doctor who's mentioned is a surgeon that worked in Manhattan, and the article mentions a hospital name in Manhattan. He received $247,000 from companies that make medical devices, and even more than $100,000 from a particular company. It's all listed in the article. I don't want to use their names, but I want you to understand that this potential for bias exists. And it's not only potential, it actually is there. There's one doctor who earned more than $328,000 from speaking and consulting, particularly from one drug maker. The New York Times called him, and he did not return the call. He sent him an email. He didn't return the email. A spokesman for the big hospital, this is big hospital in Boston, said the hospital had rigorous policies requiring disclosure and review of outside activities of its staff that limits the kind of outside activities it permits. This doctor got $328,000. The other doctor in Grand Rapids got $300,000 from a company. Wow. Now, there's a doctor from Harvard, Dr. Kisselheim, who talked about the value of company presentations. So these are companies that have lectures. The companies present lectures to other doctors. And he said these company-sponsored lectures are, quote, a very narrow educational experience. And then they went on to say it sometimes leads to ethical lapses where doctors with financial interests in companies do not fully disclose them. So again, we take zero from the drug industry. We take zero from surgeons. We take zero from pharmaceuticals. We take zero from device makers. We want to be pure. We want to take care of you with no conflict. And if that appeals to you, doctors who have no conflict, give us a call about your medical care, your cancer care, your suspicious lump or bump or your prostate symptoms or your high PSA. Give us a call at 212-CHOICES, and you can be confident we are working for you, not industry, not the drug company. We're working for you. Here's an interesting man who did call us this week. He's a man who called me up, and he said, Doc, can you help me? I've got impotence, and I've got a high PSA. I said, well, it sounds like you need some help. Impotence and high PSA, those are things that concern men. He said, but don't worry, I'm in good health. I've been juicing for 8 years. I'm doing great. And I scratched my head, and I said, Well, if you're juicing for 8 years and doing great, then why are you impotent and why is your PSA high? It doesn't make sense. Does it make sense to you? You're juicing for 8 years, you think you're doing great, and you're calling me because you're impotent and you have an elevated PSA. So there's many, many people, unfortunately, that think that juicing or some magic vitamins or antioxidants are going to change your life. There's not the data that's out there. Look at the data. I had one patient who's spending $500 a month on antioxidants and vitamins, mega vitamins, and he's seeing me because of cancer. And the more vitamins and antioxidants he was taking, the worse his cancer became, until finally I showed him the data. And there's plenty of good data to look at. So for this man who's juicing for 8 years, doing great, but has call into me for impotence and high PSA, let's fix the impotence, let's fix the PSA. And you may want to say, okay, you might love juicing. If you love juicing, great, but it's not really a medical treatment. So let's keep those things clear. And sometimes some of these supplements are actually increasing death rate, which we'll show you too if you come in. We'll show you about the increased death rate in people taking mega vitamins, antioxidants, vitamin A, C, E, antioxidants. Yeah, don't believe they're so safe. There's lots of data showing harm, both from cancer deaths and cardiac deaths in people who are taking these so-called supplements. And there's a news article out this week about the next generation human papillomavirus vaccine. Now, you know that human papillomavirus is almost ubiquitous in society. It's considered a sexually spread disease. There's actually a vaccine to help prevent human papillomavirus. Human papillomavirus is responsible for several cancers, including cervix cancer in young women and women. There's a vaccine that may prevent most of those, and there's a new vaccine, and this is an article that just came out written by Joe Cavella, who's written in the ASCO Post about new cancer news, that if you take a 9-strain human papilloma vaccine, it goes against human papillomavirus type 6, 11, 16, 18, 31, 33, 45, 52, and 58. It's highly safe and highly efficacious. If you're a parent of young boys or girls, both boys and girls can get human papillomavirus. There's hopefully a way to prevent this virus from affecting our next generation. Remember, Michael Douglas came out and he said that his head and neck cancer, and head and neck cancer is an epidemic with human papillomavirus right now. There's increasing numbers of people getting head and neck cancers thought to be due to human papillomavirus, women with cervix cancer and other cancers. So we can vaccinate our young people and help prevent this terrible spread of cancer. Again, it's preventable. 90% of cervix cases worldwide can be prevented with this vaccine. You may want to speak to your doctors and bring your children in. If you have questions, give us a call during the week at 212-CHOICES. We're going to stop for just a moment for a station identification. This is Dr. Lederman talking about cancer treatment. I work at Radiosurgery New York. We're a private cancer treatment center where we work for you, not the drug companies, not the surgeons. We don't take their money. We work for you. We are independent. We are private. We will take, of course, Medicare, Medicaid, and most insurances, but we work and report to you. You are our boss. You are the president of the United States of your body, and we'll talk to you about all the choices. We'll sit down. We'll spend time with you and answer all your questions, give you copies of your reports so you'll know exactly what's going on with you and your situation. Wow, that is different than most other places. So again, we'll be back after this word. This is Dr. Lederman on Radiosurgery New York Showtime.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why Dr. Lederman's custom tailored prostate cancer treatment is most logical. Not every man should get the same treatment.